Management Medical Group Conference in Doral, Florida. It has been so fascinating for me to see this as a bird's eye view of everything that we get to talk about every day on the cafe, and so many friends and so many people that we've worked with for many years. And our longtime friend, Joe Creek of Boston BioLife, is here, and we've got a very exciting guest joining us, Joe. We've got Dr. DeSilva here. I'm going to let Joe do the intro because, Joe, I know you have a long relationship with Dr. Silva, so I'm excited to have him.
Yeah, so I met, actually it's not that long, I've met Dr. DeSilva in the last year when I started coming to the Age Management Medical Group and recognized that he's a pioneer in the thinking of age management medicine and how it's applied in clinical practice. And he's a stored advocate for innovation in the field, and he's developed many things, and he treats patients, and he's always on the forefront. But what I found to be most interesting, he's probably one of the longest tenured faculty with the organization, and wanted to just kind of get your perspective. And this group started about 20 years ago.
Yes.
So and
it was about 20 years ago. We used to start the person that really was the impetus of this whole program was a gentleman by the name of Dr. Alan Mintz. And Dr. Mintz, in fact, we give out an award every year called the Alan Mintz Award for Excellence in Clinical Age Management Medicine. And Dr. Mintz was really the pioneer. He's the one that started this. He was the one that said, and I'll never forget him saying this, where he said, "We don't want to look at people as being normal. We want people to be optimal. We don't want your vitamin D level, normal is between 30 and 100. Optimal is between 60 and 80. I don't want you to be normal. I want you to be better than normal." And I'll never forget this one thing that he said. What he said was, normal is a risk factor for disease. And I'll never forget that.
Interesting.
Because optimizing your hormones, optimizing your nutrients, optimizing yourself is what we want. We don't want you to just be normal. I mean, do you want to wear a normal dress? No.
Me, no.
Do you want to wear like a normal bracelet? No.
No.
Do you want to wear a normal ring that is, only 1 carat? No.
No.
You got to wear a ring that is 15 carats. I mean, that's optimal.
Absolutely.
That's what you want to be. And that's kind of where this whole thing started. And I love the fact that we've continued this tradition. I was the chairman of the planning committee for 12 years. And we've always said we want the right people doing the right presentations with the right clinical data.
Right.
And that's what this is all about.
yeah, so I mean, I can imagine you've seen quite a transition from how things started to where we are now, because there's so much more scientific evidence, there's more studies, there's more publications, there's more vendors.
Yes.
And even though it's an initially kind of a small group of healthcare providers that consider themselves anti-aging, because the word itself, age management, now you hear longevity.
Right.
Either way, it's about living a healthier life and mitigating the things that make our life hard. So, speak a little bit to that.
Yeah, the evolution has been monumental, Joe. If you can imagine 20 years ago, somebody talking about hormone replacement. That's voodoo.
Yeah.
I mean, you don't do that. It causes cancer. It does this and it does that. No, it doesn't do any of that. Because if you use the right methodologies, if you use the right products, no, that's not.
We want to find the right physician.
Correct.
Right? You need to find the right formulary and the right delivery.
Sure.
Absolutely.
And you've got to be the right patient.
Right.
And you've got to behave the right way, or it won't work.
Right. I mean, you can't just change. You just can't add gasoline to your car.
Right.
You got to change the oil. You got to work on the transmission, etc. So that's what we do here.
When all of this came to be, and you started on this planning committee with Dr. Mintz, what was the thought process behind how are we going to start this revolution? How are we going to get buy-in on this? And how was he so revolutionary?
Well, he was revolutionary in the fact that he was doing this himself. He was using testosterone. He was using growth hormone. He was using supplements. He was doing it himself. And I don't know if you've ever seen a picture of him, but he was about half the size of this table. And he was a big guy. I will never forget the first time I saw him walk into a room. I was actually speaking, and I just stopped speaking because I listened. Who is this guy? And that was a long time ago. I was actually young back then, and I had longer hair than you did. But it was unbelievable. And I think he walked the walk, and he talked the talk, and he preached what he did. And what we decided back then was, we are going to keep this science-based. We're going to have references in all our slides. We're going to be CME approved, and this is not going to be an infomercial on the stage. Because if there's an infomercial on the stage, we're taking you off.
It's all science-based.
It's all science-based.
And I think it's kind of interesting that because 20 years ago, it's funny, what was old is now new, right? And when there's been a lot of this, what we consider to be revolutionary technology now, things like ketamine, hyperbaric oxygen, the nutrition, the supplements, the hormone replacement therapy, that were vilified, and they went away. And then, all it takes is New England Journal of Medicine to say, does
Can we
testosterone...
talk about ketamine?
Sure.
Because ketamine has worse connotation than taking estrogen for menopause, right? Because if you take hormones, they say, you're going to get breast cancer. Nay, that's not the thing. Ketamine, you're going to get addicted, and you're going to end up in ODing, and you're going to need treatment, and no one should take ketamine. So all of these misnomers, now it's coming back out for treatment.
Right. And in fact, tomorrow I'm speaking on hallucinogenics, medical hallucinogenics, on psilocybin. Psychedelic medicine. And I'm going to be speaking on psilocybin and the roles. But each one of those, and this is what we do, right? I always get tasked with bringing on something that is going to be groundbreaking, 5 years in the making, and people look at me and say, "What are you talking about, man?" I remember talking about CBD. I introduced CBD here, probably 4-5 years ago. I spoke on it, and it was in the market.
Right.
But back then, it was no. You're going to get high if you do that
marijuana,
stuff.
Well, look at the psilocybin. You're going to take mushrooms.
Yeah.
You can't do that.
You
That's
can't.
not FDA approved.
So, just for me, just because it's not. And by the way, 125,000 people die of FDA-approved drugs every year. How many people die of taking a bunch of vitamins every year? I don't really know of any, all right? But I would rather take... Do we need some FDA approval? Yes, we do. Absolutely. Do we need some control? Absolutely.
There's safety profiles.
There's safety profiles.
Dose.
But you know what? Just because it's not FDA approved doesn't mean that it's a good substance.
What about ketamine? What about CBD? What about the Delta 8s? What about the psilocybin? It comes out, it's great, there's some regulation, even through age management.
Right.
And then you've got other companies that start selling it at the gas station. And someone else waters it down and sells it, at your local big box store.
Yeah.
What type of regulation, how do we get that information out and education to everybody, to the masses, to say, these are the things you need to look at. They can be beneficial if taken this way, under this supervision.
And I think that's where the data comes out, right? My name was just on a paper that was published in Clinics in Medicine. And it talks about the role of full spectrum hemp oil with COVID and the data. And we looked at the inflammatory markers. We looked at what it actually did. I think what we need to understand, and what the public needs to understand, is that you have to look for the science. You have to look for the data. You can't just go to the gas station and buy it because it's on sale. It just doesn't work that way. You get what you pay for, and it's that simple. Whether it's a vitamin D product or anything else that you're looking at, there needs to be data.
And I think, to that effect, if you look at the world of vitamins and supplements and nutrition, you can go get Nature Made, you can go to CVS, and you look at how things are manufactured. So at the end of the day, pharmacokinetically, it's how do these pills make themselves bioavailable to the patient? How does the patient metabolize them? So if you look around here, you see these scientific grade and formulations of liposomal products and different delivery mechanisms, because the body metabolizes this stuff instantly. The pH of the stomach is 2. So if you throw a pill in there, so where does it get into the bloodstream, right? And then what effect does it have? So the quality, and if you look at companies like Zymogen and you look at companies like Fullscripts and some of these other nutrition companies, they all have products that you make as well. They have the highest level of formulary that's been evolving over time. And I think like anything, where you get your hair restoration products, I mean, do you want to buy it in the corner? You want to buy it from Dr. Bauman? Do you want to buy it from Dr. DeSilva? Or do you want to go to CVS? And a lot of times your healthcare provider can help you guide you to what formulas are best. So,
and we have to educate them.
Right.
You know, it's what you asked the question, is how do we get this information out? It all comes down to education. Whether you're talking about supplements, whether you're talking about ketamine, it doesn't matter what you're talking about, whether you're talking about skincare. You know, I mean, it all comes down to education, education, and education. Look at the seatbelt laws.
Right.
Right?
I remember growing up, we know a
What
seatbelt. Who wore a
Child
seatbelt?
back seat.
Right?
Seriously, no. It comes down to education.
I was in the way back of the station wagon, the youngest of 5 boys. Mother in the front, father in thing. Four older brothers somehow rammed in, and then I went all the way in the back.
And it's educating the physicians and the practitioners to get the information out to their patients. And we talked about it before. The physicians are trying to get their insurance billed. They're trying to bring the money in. They're trying to pay their overhead.
They're trying not to get sued.
Trying not to get sued. Because,
Or call for something that someone else might say you didn't need to do that.
And then you're trying to educate your patient because
It's a
that's the
process.
oath of what you take, or do no harm, and you want to educate. The more advanced and educated the physicians and practitioners get,
Right.
the more you want to share with your patients. So there's this whole array of things going on that we need academies like AMMG to get out there and to get.
We
to
also
the
have the
public.
dynamic of history, okay? So if you go back to look at the impetus of failed back surgery syndrome, the number one indication for spinal cord stimulators is failed back surgery syndrome. So back in the day when they would do these spinal fusions, they didn't know how long you would live or how long it would last. And I used to call the spine market like the world's greatest science fair. Now this is. But really, 1 million people were making artificial discs and things for this and that. But now, 20 years down the line, I mean, people are having revisions and they're having failed back surgery, and now they need a spinal cord stimulator.
Right.
So, people in their 40s or 50s like, should I have a fusion? Will these discs retreat on their own? Are there minimally invasive therapies? Can I do this naturally? Can I shift my body chemistry to prevent this from happening? Maybe I lose weight. Because like a twisted ankle or a broken bone, it will heal.
Right.
But if you lay down on an MRI and you've got persistent pain and it's radiating down your leg and you've got a compromised dorsal root ganglion and you're looking at a bulging or herniated disc, let's do surgery. That's the problem. But they've proven that people that don't have the money or the resources that don't get the surgery, sometimes
They do. And again, it depends on the degree and the severity.
Correct.
Sure.
And this is where the educated eye needs to come in. And it needs to be relatively non-biased, right? Because if it is biased, you're going to get a biased opinion. So, I mean, but again, this organization, AMMG, is an organization that I love. I've been around it a really long time. And I've met some incredible people through here, one of them being Dr. Alan Mintz. But also I have to give a lot of credit to Greg Fillmore and Rick Murner for continuing their vision in what they've done and how they've done this, on how Greg really keeps this on track with the whole CME effect. I mean, he's really, really good with that. They have separation of church and state, if you will. Rick does one thing, Greg does the other. And, we have to give them a lot of credit. We've been through some tough times with this whole COVID thing.
Online,
but it's the
in-person
online,
events.
and it's coming back, and it's because of their persistence. And I love the organization. I'm always here. I love being here, and I love educating people.
And you still practicing intern?
I do. I'm an internist. I still see patients, believe it or not. And I have a practice in New Jersey, and I have a Florida license. So I see patients down in
Internal
Sarasota
medicine.
and Naples also.
You're all over the internal medicine. I see JFK. You're right up here.
JFK Medical Center, that's in New Jersey.
Oh, that's one
In New
that's why I
Jersey.
asked you, because there's one here.
Yes, I know there's
in
one
Palm
here.
Beach County. So I'm
Yes.
thinking you're in Palm Beach County.
Yeah, no, that's in New
It
Jersey.
can be.
And how
Can
are you
be.
incorporating all of these anti-inflammation, anti-aging into your practice?
Oh, I've been doing this for 30
Internal
years.
medicine.
30 years. I've been doing hormones, I've been doing supplements, I've been doing diet and lifestyle. This is 34 years in practice for me. So I've been doing this a long time.
Life-changing.
Life-changing, absolutely.
Thank you so much. More to come. More with Boston BioLife and Age Management Medical Group.